Thank you very much, Ambassador. And good morning to Ambassador Fida as well. And thank you to all of you for being here to share and also create space. I think when we planned this session, we had not anticipated that it was going to happen at the back of new escalation of attacks in Gaza. And I welcome this opportunity to speak to you here as a childhood survivor of apartheid South Africa, but also in my capacity as the UN Special Rapporteur on the right of everyone to the highest attainable standard of physical and mental health. And although the title is long, I think it's very important because it encompasses all of that is required for everyone everywhere to be able to live a life of dignity. We have watched the horror of a genocide in Gaza that has escalated in the West Bank, in Jerusalem, and in Lebanon as well, unfolding for many, many months now, representing a continued display of a global solidarity that is recalcitrant but also repugnant in how global allies and powerful empires around the world have rallied around the onslaught of Palestinian people. This ongoing enactment of decades-long genocidal plans which have come into fruition, the systemic and the sustained imperialist violence experienced by Palestinians every single day since the occupation. The Gaza Strip is not a natural geographical point. And as we are in New York, many of us having arrived for the Commission on the Status of Women for the 69th session, we know that the assessment of the current challenges that affect the implementation of the Platform for Action and Plus 30 Beijing and the achievement of gender equality and the empowerment of women and its contribution towards the realization of the 2030 Agenda for Sustainable Development would be incomplete without this important spotlight on the going genocide. The unsilencing of CSW 69 is mandatory. We cannot continue to convene in spaces ignoring or trying to ignore as if we live in perfect bubbles. The destruction of the health system created by this genocide is incompatible with the realization of the right of everyone to the highest attainable standard of physical and mental health. And even more so, it's disproportionately impacting children, women, and girls. Israel and its allies in Europe and America have ignored the International Court of Justice. They've ignored UN experts and continue to commit immeasurable number of violations of the special protection afforded to civilians, children, and medical personnel under international humanitarian law, but also alongside the widespread violations of other international human rights laws. As we have watched that the practice of medicine is under attack by Israel, and just days into the war, medical infrastructure was being irreparably damaged. Doctors, healthcare workers, nurses, ambulance staff, and other healthcare workers were being tortured, ill-treated, harassed, detained, and some have died in prisons with signs of their torture. This harassment on healthcare infrastructure and healthcare worker directly impacts the ability of women and children to be able to access facilities, commodities, information that they require for their sexual and reproductive health, which is an integral element of their right to health. And we know that many obstacles stand between individuals and their enjoyment to sexual and reproductive health. And these obstacles are interrelated and entrenched and operate at different levels in clinical care, at the level of health systems, and the underlying determinants of health. And these are the exact levels of society, the levels of health systems that Israel continues to attack. They attack healthcare workers and infrastructure in clinical care. They attack the infrastructure at the level of health systems and commodities and supplies, and they continue to attack the underlying determinants of health. The genocide has aggravated the impact on sexual and reproductive health rights. We have seen ongoing sexual and physical assaults on women from medical teams in hospital facilities, but also women and children who are displaced. Pregnant women who are not able to receive adequate nutrition and health care, not only putting their lives at risk, but the life of the fetuses and the children they carry. We know that young people generally face obstacles when accessing information and services around sexual and reproductive health. And therefore, we understand that in a genocide, the kinds of violations resulting to their right to health, when because of a genocide, they have another obstacle of why they cannot reach these important services and information. And my mandate as the UN Special Rapporteur has received ongoing information regarding arrest and detention of healthcare workers, and also information on the lack of medical equipment, medical personnel, and also continued harassment of personnel while doing their jobs. I want to just draw us attention to why we must consider ourselves and commit ourselves to ending this genocide, but to also see it within the context of the broader imperialist agenda, a colonial agenda that is also rooted and connected to other forms of oppression, and therefore the struggle to end it must be rooted and located again within the other systems of liberation. The health consequences of racism and discrimination can persist and be passed down from one generation to the next through the body's biological memory of harmful experiences. And so experiencing colonialism, imperialism, slavery, a genocide will continue to manifest itself in poor and preventable health outcomes. And with such glaring disparities in maternal mortality and morbidity, as well as higher risks of communicable and non-communicable diseases, we cannot continue Israel's or allow them to continue with impunity. We cannot allow the silence of the world leaders. This sends a very dangerous message. The International Court of Justice has already recognized the unlawfulness of and made clear that Israel must unconditionally end its ongoing presence in the occupied Palestinian territory. This says it is unlawful, it must be unconditional in how it ends its presence. So we must continue to insist, we must continue to work and build across movements to ensure that the rights of women and girls in Gaza are protected and promoted, and that their right to human dignity, life, non-discrimination, equality, their right to control their own health and body and be partners in their own health care, including their rights to be free from non-consensual medical treatment and experimentations, is supported and promoted. And it's my commitment as a mandate holder of the United Nations to continue to do everything with the methods that I have at my disposal to continue to advocate and to fight for everyone and all of the oppressed people everywhere in the world, to ensure that the decades-long genocide, systemic and sustained imperialist oppression does end, but finally that there will be consequence and accountability in ways we are yet to see. Thank you very much, Chair.